The only acute situations we treat are the patients that are under our long-term care. So we don't usually take anyone off the street for an acute this or that because we don't know the patient. So I had a patient who has been with me for many years, and I knew that she was going through a mercury dump. And when she went through a mercury dump, her blood pressure skyrocketed to the point where if she was off the street, I would have sent her to the emergency room. But knowing she was dumping mercury, we know that mercury really puts stress on the kidneys, and as a result, the stress of the kidneys caused the blood pressure to, hit critical mass. But I knew she was dumping mercury because she's been my patient for many years, and I knew that we were, following her through a mineral program, and her mercury was at the highest level I have ever seen. And so I knew that was the cause of her blood pressure. Once the mercury came down, her blood pressure stabilized. That took about a month, so we were on critical alert during that period, but I didn't panic, didn't send her off to the emergency room. So we don't treat outsiders acutely because I don't know the patient. So I only treat acute injuries for patients that are my long-term standing patients, because then I know their medical history. I know maybe it was a metal dump, maybe it was a Hertz reaction, a retracing, an old aggravation coming up. And so this is why it's very important that I'm not an emergency practice, so I don't like to treat acute stuff. Although I know many chiropractors love treating the acute injuries, the back pains, the headaches, and this and that. And I do that with my patients that are under my care because I have a better understanding of who they are, their weak links, and as I have profiled them, I know that, this patient may have a skin exacerbation during a mineral balancing program. This patient, we may see headaches starting to come back. This patient, we may see an old knee injury start to flare up. So this is why I really don't like to treat new patients acutely. I like to establish the long-term care and understanding their medical history and what acutely may come up when they're under my care. And that's why I like to stay away from just being a emergency practice for an acute situation.